Before you view our video, please take a moment to subscribe our channel, by clicking the subscribe button, then tapping the bell icon, to never miss any update. 3 weeks pregnant, is when all the magic happens. Between 12 and 24 hours after Papa's sperm meets your egg, your genetic material has combined, baby's gender has been determined, and your single-celled zygote has started traveling through the fallopian tube. During the 3rd week the baby is called a morula. A morula is a ball of cells that is constantly multiplying. About 30 hours after fertilization occurs, the morula begins to divide into 2 cells, then 4, then 8 and so on, as it moves from the fallopian tubes to the uterus. Right now, your baby is a ball of around 100 cells about the size of a pinhead. Inside of the cell mass will become the embryo itself and the amniotic sac. The outer cell mass will become the placenta. It's still way too early to detect your little guy or gal via home pregnancy test. Your body likely hasn't started producing HCG. And most mamas won't even realize they're pregnant for several more weeks. But most of women can find these symptoms and changes in their body and daily life. Emotional changes. From the moment you find out you are pregnant, you will surely feel a heightened sense of emotions and you will likely experience changing emotions throughout your pregnancy. Many things, including hormonal changes in your body, can contribute to mood swings. Sense of smell. Do scents suddenly seem stronger to you than ever? It could be a sign that you are pregnant. A heightened sense of smell is a very real side effect of pregnancy caused by the hormone estrogen, which magnifies every little fragrance wafting in the air around you. Whether it's the food your neighborhood restaurant is cooking up, the garbage on the street corner or your husband's cologne down the hall, your keener than ever nose might be picking it up. Metallic taste. If you feel like you've just put some change from your wallet into your mouth, you're not alone. That metallic taste is frequently a side effect of pregnancy and one more you can chalk up to the hormones wreaking havoc on your system, which can make your taste buds go wild. Until they settle down in the 2nd trimester. Implantation bleeding. Some women notice a small amount of red spotting or pink or reddish brown staining around the time they should get their period. If you have pain along with spotting or bleeding, call your healthcare provider immediately because this can be a sign of an ectopic pregnancy. Morning sickness. It usually starts at about 6 weeks, but it can start as early as 4 weeks, or around the time that your period would be due. A few women experience nausea even earlier than this. It's called morning sickness, but it can affect you at any time of the day. Fatigue. During the first few weeks, your body is working 24/7 behind the scenes. The pregnancy, and fatigue is a normal response. The hormonal fluctuations and the extra work happening inside the body makes you feel tired. Increased levels of the hormone progesterone and the extra effort required to start making a baby can make you feel as if you've run a marathon when all you've done is put in a day at work. Basal body temperature. There will be an increase in the basal body temperature, which can be known if you have been charting the temperature. It's typically about half a degree or more higher or so when an egg is released and remains elevated until you get your period. So if you're charting BBT and notice it hasn't decreased in more than 2 weeks, it may mean you've got a baby on the way. Frequent urination. You might think frequent urination comes later, when the baby presses on your bladder, but an increase in bathroom breaks sometimes starts early. Not only can the swelling uterus put pressure on your bladder, but the extra blood flow to the kidneys, which begins right away, also causes them to produce more urine. A healthy pregnancy can be achieved with a healthy lifestyle, and for that, you need to follow the right habits.